The targeted therapy space is incredibly exciting. We went from having 0 drugs approved to about 5 drugs approved in the span of about 2 years. The obvious space first is the FGFR fusion positive cholangiocarcinomas, and we now have 3 drugs that have accelerated approval in that space, but we also have this kind of second generation of FGFR inhibitors with early data from Relay that was presented at ESMO, where there is incredible overall response rates in a small number of patients so far, but hopefully as that data expands, we'll get a better sense of that, as well as potentially some benefit of these types of drugs in FGFR treated patients, which I think is going to be a really important space since we have a number of drugs on the market. In IDH, we have Ivosidenib that has been FDA approved and absolutely is an option for our patients with IDH-1 mutations. And then there's also this, again, next generation of IDH inhibitors that are still in trial that a lot of us have our eyes on. I think the kind of more exciting or newer spaces include things like HER2 targeting, where we have kind of top-line press releases from Zanidatamab that appears to be an effective way of targeting HER2 positive biliary tract cancers. And then there's a lot of new targets like MDM2 amplifications and a lot of drugs that are being looked at in kind of early phase trials so far in those targets.